Tisha.
Good afternoon, everybody. My name is Pam Tietz, and I am the director of the Spokane Housing Authority. I'm also the chair of the Continuum of Care for Spokane County. And we were asked today to talk a little bit about the Continuum of Care and the importance of it and how it works and what the components are. And so I asked my compatriot from the city of Spokane, Tisha Danzig, to help me with that, and she graciously agreed to do that. Many of you probably already realize this, but the Continuum of Care is really a community-wide group of interested people who work on the 5-year plan to end or reduce homelessness. And the idea is that you would quickly rehouse people and minimize the length of their homelessness. And so this group works together. It's a group of different systems. And the idea is to effectively utilize the components of the system and reduce the length of homelessness. I'm having problems with my PowerPoint, of course. There we go. Continuum of Care is also a funding stream that is put together by the Department of Housing and Urban Development. And so it's this advisory body that helps decide how to spend the money from the Continuum of Care for the homeless. Depending on your location, you might have a local Continuum of Care, which would be city or county, whatever your local jurisdiction is, or if you're in a smaller area, you are part of the state's balance of state Continuum of Care, and the state applies for those smaller jurisdictions for this HUD funding and helps decide how to spend the money in those smaller jurisdictions. And I'm going to have Tisha talk about the homeless crisis response system and what that looks like and the different components and how important that is in each jurisdiction.
Thanks, Pam. Like Pam mentioned, my name is Tisha Danzig. I'm the senior manager for our Community Housing and Human Services Department at the local government. Part of my role is helping to facilitate this crisis response system with a team of homeless service program professionals. So I'm pleased to talk to you a little bit about what that system looks like. So this is just sort of a synopsis of what the homeless crisis response system is. But ultimately, the goal of an effective crisis response system is always going to be prevention first, whenever possible. And our 5-year plan speaks specifically to prevention. But if we can't prevent somebody's homelessness, the next keys are identifying who's experiencing homelessness and identifying them quickly, connecting them to housing as quickly as possible. And that looks like a number of different things, and I'll talk about them in a second. And then providing services when needed so that people can be in stable and permanent housing. So prevention first, then identifying, connecting, and providing services if we're not able to prevent homelessness. So I want to first talk about emergency shelter. When we talk about a homeless crisis response system, emergency shelter is what people think of first. And it's really important. We want to be able to catch people as soon as they become homeless and have someplace safe for them to be. In the Northwest, we have extreme weather, and we want to make sure that people don't die on the street. So emergency shelter is certainly a critical component. But what I think people sometimes mistake is that there are 2 different models of emergency shelter. So what people think about often are night-by-night emergency shelters where somebody queues every night for a bed. And that's a really critical emergent sheltering need. And we always need to have night-by-night emergency shelter space in order to help meet that crisis intervention. But the other part of emergency shelter, and it's typed the same in our databases and HUD and our state reports, it looks the same, but what it actually is what's called continuous stay emergency shelter. And that allows somebody to check in and they don't check back out until either they forfeit their bed because they've been missing it for a while, or they're connected to some other service or program. So those stays are usually around 90 days, or that's the target for them. But I just want to point out that when we talk about emergency shelter, sometimes that's emergency night by night, and sometimes that's a continuous stay emergency shelter where you are checking in and checking out and having that stability, knowing where you're going to sleep every night. There are a number of other interventions in a homeless crisis response system that are really critical to think about. We classify it as about 6 other categories. 2 of them are permanent housing focused, and the others are different components of that coordinated system. Diversion being the first one, and that's tied to prevention. So it's having different kinds of conversations with folks when they enter homelessness and they show up and they're trying to get help, helping them strategize and troubleshoot ways to get back into permanent housing quickly, whether that's sometimes a one-time financial assistance to help them get back on their feet. Sometimes it's being a mediator and a guide to help them get connected, but diversion is really a prevention strategy. Coordinated entry for us is really critical because that's a one-stop shop where somebody can go and get assessed for a number of different factors that are relating to their crisis and help them get connected to the best kind of housing intervention for them, but also other services when needed. Outreach is really that one-to-one connection. We know that shelter is not going to work for everyone, and some people are going to camp, but having strong outreach partners to be able to go out there and build that relationship with someone to help them get over whatever barriers they're facing and into permanent housing is critical. In Spokane County and our Continuum of Care, outreach has really been reprioritized and reemphasized because of the successful outcomes that we get from that one-on-one interaction with folks. So I can't underscore the importance of outreach enough. And then the last 3 are really housing interventions. Transitional housing, it's anywhere from 90 days to 2-year intervention. It's not considered permanent housing, it's temporary housing. But what we miss in that conversation is that temporary housing, 2-year housing is a best practice for certain populations, like young adults, 18 to 24-year-olds. So it is a really critical component of a coordinated system. And then the last 2 are rapid rehousing and permanent supportive housing. Rapid rehousing, rapid reentry is a way for people to get short-term housing assistance, rental assistance that helps them get stable. So if you've interfaced with something that's been really hard and you were down in your luck for a bit, this can help you stabilize quickly and move you into permanent housing. Permanent supportive housing is that much more critical intervention where you need to give somebody 24/7 access to supportive services and to help them overcome life barriers or something with their mental behavioral health and supports. So permanent supportive housing ends up being a really critical component for our system, and that looks like both a facility-based model, looks kind of like a hotel or an apartment building, and then scattered site where people are placed all around in smaller units. So those are our key interventions in the crisis response system here in Spokane.
So one of the things that we know here in Spokane County is that homelessness impacts people differently, and your system has to be designed to address each of those individual needs. So what works for families may not work for individuals, and what works for older individuals may not work for younger individuals. And so you need to have different components of your system to address each of those needs. And this is the way that we have it set up in Spokane. And I think it works pretty well. And we've kind of rallied groups around each of these populations to address those specific needs carefully. Youth and young adults, families, single adults, and veterans. And we kind of just provided a list here of who you might want to include in your population specific committees. And so we have committees that meet at least monthly for each of these different groups to address what's working, what's not working in the system, to talk about how to fill the gaps and really be able to evolve as the conditions change over time. I can't say enough about the amazing folks that are working in each of these areas. You know, I'm the chair of the Continuum of Care, but these are the people who do the work. These people on these committees are the ones that do the work. And so it's really important to gather as many of thing folks together as you can in order to get the work done.
Can I add one thing about that really fast? One lesson learned that Pam and I were very well versed in was that it has to be a diverse group of folks. It has to meet a number of sectors in order to really address needs. So we had some growing pains 3-4 years ago now in learning that lesson, because we were thinking homeless service providers, housing providers, that makes a lot of sense. But having all of these other sectors at the table has given us a really collaborative and wraparound approach to being able to help at the committee level.
Yeah, we're going to show you what that looks like here in a little bit.
Sorry, Pam. Thank you.
So we're going to talk a little bit about the Continuum of Care leadership, who needs to be in that group, and also, you know, we have a Continuum of Care board, and our board has 25 people on it now. We started it with fewer, and we discovered that that didn't quite work. We needed some more folks on the board from different systems, because it takes many systems to make the whole thing work. And then in addition to that, we needed to have people with lived experience, and not just a token person on the board, but we needed several people on the board that had different experience of homelessness. For instance, someone who is maybe homeless as a youth versus a homeless veteran. And having representation from each of those groups was critically important in doing our planning. And the reason is because we use the board to make system level decisions in creating our response system to address each of those needs, and to leverage as many other resources as we can across the system. And that's important because the money that comes from the Department of Housing and Urban Development is not sufficient to cover the whole system. And so you have to have other avenues with which to do that. So here's our example of who the different systems are that we have on the board. And in Spokane, we have different governmental jurisdictions, and it's really important to us that we have someone from each of those government systems to be represented so that they have some say in how the system is evolving, but also so they can bring resources to the table. That's critically important because they will bring funding to the table as well. The Public Housing Authority, I know that there are Continuum of Care groups that maybe don't have the Housing Authority at the table. I think in Washington it's probably pretty common, but in other states they don't have the Public Housing Authority at the table, and their Continuum of Care doesn't work very well. And the reason is because the Housing Authority is usually the single largest resource for housing in your jurisdiction. So it's super important that you be involved. And some housing authorities think, well, we don't do homeless housing, so why would we be at the table? Well, here's the deal. It's a continuum. It's everything from homelessness to home ownership that you need to create in your system. And so if you're the largest housing resource in your local jurisdiction, you absolutely need to be a part of the Continuum of Care in a very active way. And something I think is worth noting here is that we've got all of these groups at the table, and we made a very deliberate decision that when we went to these groups and asked for someone to be on the Continuum of Care board, we wanted somebody that had decision-making capability representing their agency, so they could actually make decisions and commit resources to the Continuum of Care. So we're not talking about program level people. We're talking on the board, we're talking about decision makers. The program level people in Spokane participate at the committee level, but at the board level, we asked for decision makers to be the representative. And I think that's super important to do. We also involve the business community, healthcare, veteran services, law enforcement, children's administration, aging and long-term care, homeless services providers, local philanthropy. We also involved the school system. We just recently added a component for higher education. So we've got our higher education system now involved. And then we also have people with lived experience from different parts of the group. So we have a homeless youth, homeless veteran, homeless single, somebody who was a homeless family or previously homeless family. And I cannot tell you how important their contributions have been in our planning around what the system looks like and how it works. We got feedback from them that was crucial in our planning, especially, I'll give you an example, around homeless youth. We did a planning session with a group of people that were 15 to 23, basically, around what the solution for them would be, what it would look like, feel like, what services would be included, and what we thought we were going to design for solutions was not what we ended up designing. We did a completely 180 different direction and created a pipeline of projects that is still being put together. It looks very different from what we thought it would be because we had that input. It was really important. Every continuum of care has to have a collaborative applicant. For you small rural areas, that's the state of Washington. For us here in Spokane, our collaborative applicant is the city of Spokane.
Yeah. The collaborative applicant is basically just an agency with the fiscal management and operational oversight over the continuum of care. So it administers the grants on behalf of for us, the region, so Spokane County, and we coordinate the continuum of care board and efforts. I think that part gets a little bit confusing. So we always like to distinguish what the collaborative applicant does versus what the continuum of care board does. And if anybody is unsure who their collaborative applicant is, that it's all online on HUD's website, so you can figure it out. But if you're interested in learning more about your continuum of care, talking to the collaborative applicant is a great place to start. And I just want to talk a little bit about what the role of the collaborative applicant is, because it certainly is critical that the collaborative applicant is working with the continuum of care board to implement the 5-year plan. But then there's a bunch of those behind the scenes things that if you're trying to learn more or understand why decisions were made, it does help to go back to the collaborative applicant's role. And a lot of this is dictated by the Department of Housing and Urban Development. So the first part is really just to coordinate the system. So it's having staff at each of those subcommittee meetings, working with the frontline staff, making sure that the HUD guidance is being followed, and then hearing and reporting back at different levels to support those committees. But then also the coordination of some level of the board's role and how it interfaces with other local governments, other local jurisdictions if you're in a larger COC. The application process is pretty significant, and I'm going to talk a little bit about that in a bit. But this is resulting really around that continuum of care funding stream, and that's renewable money that can be sort of the backbone for your homeless crisis response system, based on a written application about your system, and then applications for each of the projects that get to be either renewed or new projects each year. And that involves a ranking system. So looking at performance, the Continuum of Care for Spokane County really refocused a couple years ago on performance-based funding and on really evaluating how projects are being implemented and their success rates. That was really critical for us because we want to see a 5-year plan that gets that's successful, because we care about our citizens and want to move things forward. So looking at that annual ranking, so you say this is the highest performing project all the way down to the lowest performing project. And then,
can you give an example of what a performance indicator would be?
Sure. So exits to permanent housing for an emergency shelter would be a performance indicator. If you're looking at a permanent housing project that somebody's already in there and they're having wraparound services, did they have income growth from year to year? That might be a performance indicator. Length of time, length of stay in an emergency shelter, because our goal is always to reduce that length of stay in shelter and help somebody move forward into permanent housing. So we want to see a system that has a really light touch, is able to meet that person, make sure that homelessness is rare, brief, and non-recurring. That's the mission of our continuum of care. And so those performance indicators are aligned to be able to see that. And we can absolutely share what our system's performance indicators look like if anyone's really interested in performance-based funding and what we've done in that, because I think our continuum of care has been really successful in trying to move that forward. And what we've done is done quarterly reporting and truly try to have a data-driven discussion from the committee level all the way up to the board. That's always a learning process, because performance COVID, for example, has impacted some of the performance, but we're still getting a lot of really great successes out of our system despite a global pandemic. So, you know, as people and agencies start to really think and focus in that way, and the collaborative applicant gets to reinforce that through contracting, it does help us move the system forward. Oversight, I want to just share again, that's that 5-year plan. And when we rewrote our 5-year plan this year, it has a lot of the same objectives as the rest of the state, because Department of Commerce, Washington State Department of Commerce wanted to try to align all of our goals. But we wanted to make sure that everything was really, there were targets and check-in points and objectives that we were trying to meet that were measurable to align with our performance planning. So having that oversight and making sure that we're facilitating the partnerships and the progress necessary with all of our partners is a big part of the collaborative applicant's role. And then that ongoing monitoring to make sure that things are moving forward, and that if they're not, and maybe something deviates from the program rule or the performance is struggling, what kind of technical assistance and support can we offer an agency to try to move the needle and get everybody back on the right track, so that our community gets to be high performing and very successful for those who need it. So I think that's the bulk of the collaborative applicant roles for today.
Well, in a large jurisdiction like Spokane, I can't tell you how important it is to have the collaborative applicant, because the COC board in and of itself would have a really difficult time doing that work. And for those of you who are in small rural areas, don't underestimate the amount of work that the Department of Commerce is doing on your behalf to submit these applications. We run a lot of HUD programs as Housing Authority, and I can tell you that the Continuum of Care application is the toughest one that I have seen in my 30+ years. It is hard. It is not an easy application. It has a lot of details that you have to address and identify, and it's probably the hardest one I've ever seen. So, big appreciation. I want to talk just a little bit about how the Continuum of Care can make system level changes based on the advice and direction of the not just the board, but also the committees and people with lived experience from different parts of the system. And these have been game changers for us. Coordinated assessment, the one-stop shop where someone who's experiencing homelessness or housing crisis can go into one door and have access to all of the benefits that the system can provide. You can go in and have a conversation and try to figure out how to address your specific situation. In Spokane, we have 2 points of entry for coordinated assessment, and we've done that really deliberately. We have one for families with children, and we have one for singles. And Catholic Charities oversees the family coordinated assessment site, and the local community action agency, SNAP, oversees the singles coordinated entry point, and they do an amazing job. We've put together policies and procedures so that they're standard operating in that system, and it's really important. The diversion first approach is something that we've recently added, maybe last year. What we were finding is that everybody was coming through the door for coordinated entry, and we simply didn't have enough resources to help everybody that came through the door. So you'd come through the door and we'd say, "I'm sorry, we can't help you." And that was not the conversation that we wanted to be having. So we added this diversion first approach where everybody who comes through the door, the first thing that happens is you sit down with them and you have a conversation about their specific situation, and you try to help them figure out what access they might have to resources of their own, whether that's family or friends or an employer, whatever that is, and you try to help them self-resolve before they ever enter the homeless system. And I think the statistics go like this. About half the people who walk through the door are really willing to have that meaningful conversation about how they could self-resolve. And about half of those people actually do self-resolve and never enter the homeless system. So roughly a quarter of the people who walk through the door, we can help self-resolve their situation, and that preserves some of those other resources that we have for other people who cannot self-resolve. It's really changed the way our coordinated entry system works in a very positive way. The other thing is that HUD requires coordinated assessment for if you want to have access to Continuum of Care funding. You have to have coordinated assessment. And so in the beginning, everybody set up coordinated assessment exactly according to the HUD guidelines because it was required and that's what we were going to do. HUD still has very specific requirements that you have to adhere to, but I think it's really important that you sit down and actually look at your own system and values for your community and figure out locally what kind of prioritization you want to do. Right now, most of us are using the SPDAT assessment tool. Tisha, do you remember what that stands for? It's a vulnerability assessment tool.
Yeah, prioritization and yeah.
Actualization something.
Yeah.
Anyway, you ask some questions to gather some information about the household, and depending on what their score is, it tells you what type of intervention they need. Do they need emergency shelter? Do they need permanent supportive housing? And then you can prioritize them based on their scores so that you can refer this person over this person because their needs are higher. And we were all doing that according to exactly what HUD said we were required to do, but we hadn't taken into account the local context about what our own local priorities needed to be based on our own situation. Because homelessness in, I'm going to say Port Angeles because I lived there for 20 years, does not look the same as it does in Spokane. And so you need to be able to customize a little bit how you prioritize people coming through the door. And that was a very long and very painful conversation. But we got there as a group, and I think our system is better for it. Sometimes you have to have the tough conversations and you have to prioritize because there's simply not enough resources to go around. Strategic planning is something that looks very different for us than it used to. 5-6 years ago when we did our 5-year plan to end homelessness, again, we did exactly what we had to do according to the guidelines. And we adopted a 5-year plan to end homelessness, and then it sat on a shelf. Don't do that. This time, what we did is a very comprehensive and inclusive process where we looked at the local context and we followed the guidelines, but we added our own stuff to it as well. And I think you want to make sure that your document, your 5-year plan, addresses that and that there are steps and measures in it that you can follow so it does not sit on a shelf. So we're going to be looking at our 5-year plan at least quarterly to measure performance and progress. And that way it doesn't just sit on a shelf and collect dust. Super important. Evaluation and alignment of interventions. Tisha, can you just touch on that?
So what we started doing in our system was, because we started moving towards performance-based funding, we're able to take a step back and say, for example, what shelter models are working in our system? Are night-by-night shelters that are this size or this size, like large scale or smaller scale, having what kind of results? What does the recidivism rate look like? Do we have night-by-night and continuous day shelters for each population? And does that make sense? So we were able to evaluate the effectiveness of our different programs and try to align funding and support to make sure that we had a more comprehensive set of interventions to meet the needs based on data. So that's helped us look at specifically for us, shelter, our jurisdiction's pretty large, and in the last couple of years, as Pam talked about, local context. In our local context, we were having a lot of conversation about emergency shelter, and municipalities wanted to invest more in emergency shelter, and we were going, shelter doesn't end homelessness, permanent housing ends homelessness. so we need to invest wisely to get somebody to move in that direction. So being able to look at data and say what's working, what doesn't, look at our local context and say what makes the most sense, how do we need to have this conversation, has helped us be able to course correct and really better align what our goals and our 5-year plan are with what our realities are locally.
Then there's systems policy, and I'll use our moving on strategy as an example. So here in Spokane, as a part of our system, we've been blessed to be able to create a significant number of permanent supportive housing units using 9% tax credits from the Washington State Housing Finance Commission, and then building in permanent housing with supportive services. And the reason that works, by the way, is because the Housing Authority provided project-based Section 8 to those to help them cash flow. If you're a larger housing authority and you have a lot of vouchers, it's pretty easy to do that. If you're a smaller housing authority, it's pretty hard. And so it's not always possible to do that. But one of the things we discovered is that we've built probably close to 500 units of permanent supportive housing over the last 5 years. And we're not going to build our way out of this. It's just not going to happen. So what we decided was that we needed a strategy people were moving into permanent supportive housing, but they weren't moving out, to free that up for the next person who needed it. And so having a strategy that we could adopt that would actually sit and help that person get to the point where they were actually ready to move out of permanent supportive housing to a less intensive setting. And so we just recently adopted a moving on strategy earlier this year. And the idea is that rather than just trying to build our way out of it, we would have this additional component to free up those units to make them available for the next person.
That's pretty critical. So I'm going to talk really quickly about the COC and funding, the Continuum of Care and funding. Like Pam mentioned, it's a really complicated, complex, multi-tiered funding reality that the City of Spokane is the collaborative applicant. It passes through us, so we have to oversee the process. So ostensibly what there is there are 3 different components. Certainly there are just applications. So new projects, HUD might say, we have X amount of dollars for new permanent housing projects, permanent supportive housing projects. And you can apply to add new projects to the system. There's renewal projects. So there's some level of renewable funding every year from HUD for the Continuum of Cares. And that's based on that ranking. So all those projects that are applying for renewal get ranked by performance. The Continuum of Care can decide if they want to voluntarily reallocate dollars, or what happens is they go around the country, they read your applications, and then they fund to a tier level. They call it tier 1 and tier 2, but to a level where they have that much resources for all the Continuum of Cares, and then anything under that is kind of a bonus. And so that's that renewal projects, and I'll talk about how it all comes together. And then there's the consolidated application, which is the collaborative applicant facilitates, but it's really an analysis and an assessment of your entire Continuum of Cares response. So how are you addressing domestic violence in your community? We've seen that in our point in time count numbers is in our annualized system is a really significant problem locally, and we're seeing more and more people becoming homeless because of domestic violence. There's sections in there that specifically talk to that. And the collaborative applicant with the Continuum of Care board responds to those kinds of questions, and HUD evaluates all of the applications based on that. So that's really sort of the guiding document of how your system is working together and integrated, who from what sectors are involved in that conversation, and how you can move the system forward together, and what do you have at your disposal to do that. So the whole package together goes to HUD, and the way we move that forward is through a review process that includes a funding and RFP committee that's made up of system experts and other funders, so that they can look at performance and look at HUD guidelines to see how our projects are currently aligning. That's the performance ranking. Being able to determine how are our projects doing, what's making sense locally in our community, is it still fitting and aligning with our 5-year plan, And then we add in those new projects and say we want to prioritize this new project over these projects, but maybe not over these because it doesn't necessarily fit into our system. And then that package goes to HUD. They again fund as many projects as they can for all continuums of care. And then based on how well you score on your consolidated application, you may get more projects funded that are like in that tier 2 category. We've been pretty lucky to get a couple of those that have either straddled or fallen below that line. But the real big part about this, from where I'm sitting, is it does make you have some really hard conversations as a community to know what is working, what's not, what do we need to hold more accountable next year, because we're going to save this project because it's really important, but what do we need to do as a community to make sure that it's successful next year, because we don't want to lose that reoccurring funding for that kind of intervention. So we do have some really hard but really eye-opening conversations during this process.
So Tisha, for folks who may not be familiar, this, for an area like Spokane, the amount of this funding is significant. It's it's
just under $4 million now. Just
under $4 million that the Continuum of Care brings to our community to help with these interventions each year. So it's worth it to do it. If you're from a smaller jurisdiction, the state publishes a notice and you can apply for funding with their help and to be able to participate in Continuum of Care funding as well. I know when I was in Port Angeles, we had permanent supportive housing that was supported by the state balance of state Continuum of Care funding there. So even as a small jurisdiction, you can participate and you can bring those resources to your community.
And one of the great things about just participating is that you then get to be part of different kinds of think tanks and work groups and learn from others all around the country that are going through very similar growing pains or learning a lot of new information. So it's certainly, it can be challenging, but it's worth it.
Well, and I think that's really important to note too, is you don't necessarily have to reinvent the wheel. Go find best practice models in other places and bring them back, because they exist and they are out there. So we wanted to make sure that we left time for questions. And so I am going to open it up for that, and I'll stop sharing my screen, and then I can see the chat box.
I did share on the chat that SPDAT is the Service Prioritization Decision Assistance Tool. And that's why we can't ever remember it.
Thanks, Tisha.
Yeah, no problem.
Do we have questions from folks? Oh, come on, there has to be somebody that wants to ask a question. I know I have staff on this call. You have to have questions. No, I don't see any. Guess we could give it.
Maybe I'll complicate it and see if we can inspire anyone to have a question.
Okay.
So the way our Continuum of Care is set up is we want to create that truly coordinated system. So that's part of why we talk about it as Continuum of Care board and system and Continuum of Care funding, is we are trying to funnel all of our funds that go to homelessness or the homeless crisis response system through the Continuum of Care board. And that is a little bit that was met with skepticism and curiosity, I would say, at the onset.
That was kind.
Well, we've been able to manage it through the city of Spokane. So one of our jurisdictions is doing it exclusively now through the Continuum of Care board, because we really do feel that having that coordination recognizing that the continuum of care funding stream is a really good backbone because it's reoccurring funding that you can count on, but it's not going to be all the money that you need in order to prevent or end homelessness in your community. It's one part of it. And the best way to unify and strategize together in that coordinated way that the Continuum of Care Board does allow us to do is to funnel those other resources in that way too. So we're continuing to have that conversation with all of the municipalities in our Continuum of Care region. And it's certainly moving in that direction, and because we're trying to lead by example as the collaborative applicant. But I think that we've seen some really positive conversations that have happened as a result of that. Hey, see, it worked. There's a question.
So in the case of Spokane, which agency started the process to pull the agencies together for the Continuum of Care program? You know, the Continuum of Care here in Spokane really was started by the agencies that were providing homeless services pretty tight with the city of Spokane, and was really driven by them. And HUD came in and said, you know, that's not really the way it's supposed to work. This is supposed to be more of a system-wide thing. We want you to have a very autonomous board do something about it. And so we were required to change it, and we decided to do it in a big way. So homeless services providers, the housing authority, the city, the county, we hired a facilitator to come in and have some of those really hard discussions about what the board should look like and how we would get there, and who should be part of it, you know, above and beyond what HUD wanted to see and what did we want to see. And it was a year-long process really to change the way that it was operating to this model. And there were some growing pains that went along with it because some of the service providers really felt like we were taking away their control, which is somewhat true. But I think that they've realized that they still have input into the system and are willing to be at the table and have those conversations. And the way that this new board functions is much, much better because we're pulling in other systems. Not only do we have their input, but in many cases we are able to leverage their resources to bring to the table. And I'll give you an example. Spokane has an Envision Center, which is a HUD designation. That Envision Center would have never happened had this Continuum of Care Board not been formed when it was, because that's a collaboration between the City of Spokane, the Housing Authority, and the Workforce Development Council. And that connection to the Workforce Development Council happened because the guy that runs the Workforce Development Council sits on the Continuum of Care Board. And so we were able, you know, you had very little time to respond to that request for, do you want to have an Envision Center? And we were able to actually say, hey, Mark is the head of the Workforce Development Council, we want you to sign this letter. And he just said yes. He didn't really question it. And it's because we had built that relationship with him and he trusted us. And then when we got the designation, he says, okay, what does this mean I have to do? And so then, you know, we figured it out. And here's the deal. The Workforce Development Council is running the Envision Center, basically. Not only did he participate, he really stepped up in a big way. You know, the city put a lot of resources into it to get it up and running. And the Workforce Development Council is actually managing it. So that's been incredible. So there's a good example of why it's important to have those other systems. We've built these relationships in this amazing level of trust between us. So if I have something going on and I need to call on somebody else, I can call somebody else on the Continuum Care Board and they don't hesitate. They just say, yes, let's do it. It's super important to have those system level discussions. So pulling it together, group effort, took a long time, some growing pains, totally worth it.
Well, and I think that was mimicked across from the board level all the way down to the committees. Because when that shift was happening to the current iteration of this board, all of the housing and homeless providers were like, we must stick together. And they were made up the committees almost exclusively at the beginning.
Mm-hmm.
And it was the youth committee, we applied to do the 100-day challenge to end youth homelessness.
Another
And
example.
that was the first time we were faced, they prescribed who needed to be on this team. And we filled it in because those were the best people we knew how with the board based on that information. And there was a while there where there was a lot of growing pains as they understood, well, I am a frontline staff person working in this space. I don't understand how I can help contribute to this when this is what you do. And helping them get their lens to the table really made a profound shift in the way we envisioned our youth system, our youth homeless crisis response system. And what we ended up doing was improving those connections and those relationships so much that we're now 3.5 years past our 100-day challenge, and we're still housing young people at the same rate that we did when we were making these system level changes in the 100-day challenge, where it was a sprint to try to house young people. And
by the way, we committed to housing 100 young people in 100 days, and we housed 109. We housed more than King County and more than Pierce County, right?
Yep. Well, I think percentage, we met our goal, and yeah, it was incredible.
It was intense.
It was exhausting, and now it's normal because the systems have changed and improved to keep all of these sectors in mind. So I think it's really important, even if you don't know why you fit in to this conversation, or you don't know why this other agency does, but you know that they probably have met people experiencing homelessness or in housing unstable. Like, they do need to be at the table for that conversation at all levels, because it does have a really critical system shift that we saw happen in our community, and it's continuing, it's pervasive. We're still housing at that same rate.
So the next question is, what kind of outreach is done by the COC to identify and bring agencies to the table who are not participating? And is the COC at a point now where agencies are reaching out to the COC to inquire how they connect to the COC? I can answer the second question. Absolutely, yes, because I get emails on a weekly basis from people who want to know how they can get involved with the Continuum of Care. Tisha, I'll let you maybe answer the first part.
Yeah, so we do a couple stakeholder engagement meetings a year. It's written into our Continuum of Care's governance charter, ways to do outreach to those that are not coming to the table. For us, that looks like a number of different things, because some of it's at the board level, certainly, because we want people in decision power that maybe aren't engaging to figure out how they can get involved. But I think probably the most critical component has been doing some of that outreach to get involvement at the subcommittee level, because really that's where we look at our subcommittees, those youth, veterans, families, and single adult committees, as the advisors, the experts. They talk to us about what's really happening, and they bring recommendations up to the board through the planning and implementation committee, and that's how these changes get made. And if we're doing that in a vacuum, where it's just these very specific agencies, we're missing some of what that whole solution looks like. So there's been some really, really intentional targeted outreach to service providers that otherwise aren't engaged through those subcommittees to try to get them to be involved. That's looked like a number of different things. It can be literally just a phone call from me or from Pam or from someone saying, hey, executive director at X organization, you are serving veterans better than anyone, and we're missing your voice at this table. Can you please participate in the subcommittee level and or share information about your agency and what you do to the board, so that we can figure out best ways to get you involved? And that has been really successful. Oftentimes if we can get somebody to go to a committee meeting for 3 times, they see their value and why their voice is needed at the table. And generally, if you can improve their work and improve what they're trying to do through that coordination and collaboration, people are more eager to get involved. So it's just getting them to commit to get in the seat for a couple times, and then and then it's sort of done it for itself.
All right, I think we're being asked to wrap it up. So we will do that. Thank you. Our contact information
really
is
close
in the
to
slides.
time. Yes, and Pam and Tasia, their information should be on the app. So if you have any more questions for them, you can contact them through there as well. I put up the code for the class, so that way y'all have it. Thank you, ladies, so much. This was a really great session. We appreciate everybody participating in the virtual conference.
Thank you so much for letting us be here. We really appreciate it.
Absolutely. Thank you.
Bye.
Bye.